Hello everyone, Assalamu alaikum, welcome back to my channel. So today we're going to discuss the causes of developmental delay, and the first cause is genetic. So whilst there may be no specific substrate that is linked to developmental delay per se, there are patterns within families, and that can be seen, for example, if a mother or father is unable to talk or walk at a certain age, their child may show the same. So the child at that age may also be like the parents. And the other is environmental. So there are a lot of environmental factors that may lead to developmental delay and later on a developmental disorder for the child. And there's different stages of development, so these changes can occur at different stages of that development. So the environment can still affect depending on the age, for example. Now I'll try to cut this up into 3 different periods of time. So the first period will be antenatal, so before birth and during pregnancy for the mother and the child. What can cause developmental delay at this stage till the 20 weeks of pregnancy. The next stage will be from the 20 weeks of pregnancy till around 1 or 4 weeks, which is around 1 month after giving birth, after the child is born. And then the last part will be postnatally, which will be at the end, after the 1 month of pregnancy and after the childbirth, after the child is 1 month and above. So let's start off with antenatally. What can cause developmental delay antenatally? The first is genetic factors or disorders. The second is maternal infections, whether early or later on in pregnancy. And the third is whether for the mother it's the first pregnancy, or the mother waited short time between the pregnancies to have a child. So there's short time between the pregnancies, and then whether it's a teen pregnancy, so a younger lady or a younger woman is pregnant, and there could be vascular issues, whether it's a hemorrhage or acute occlusion. And the others are the prescription medications. Now, it's very important to discuss this with your healthcare provider, what medications you're on, what you're using during your pregnancy. It could also be topical, which means on the skin. And it's very important to discuss this, as this may have an effect or cause developmental delay in your child later on. The other important factor to consider is toxins. So this could include drugs, for example, smoking, shisha, for example, alcohol. If you're taking pain medications or opioids, it's important to discuss this with your healthcare provider to look at the best way forward. And in our case, very uniquely to the east of Africa and certain other countries, the use of khat during pregnancy has been linked to low birth weight. Although there's not a lot of studies about it, I found this one particular study, and I do believe within the context it's important to remember the effects that different drugs and different stimulants can have on pregnancy. Okay, and the last one is poverty. Now, poverty can affect different aspects of your life. It could be nutrition, it could be stress on the mother and the child later on. So it's important to consider, and it's important to look for support in your area or among your family members, whoever is there for you. Please do not be scared to ask for help, especially if people are willing to give it. The second stage is the perinatal, from the 20th week of pregnancy till the first month of the child being born. So what can in this stage cause developmental delay? First, you have intrauterine growth restriction. So when the child is smaller compared to children their age inside the womb at around 20 weeks. So the other thing could be prematurity. So prematurity when a child is born before the 9 months. And there's periventricular leukomalacia, which is a brain injury common in children who were born before the 9 months, which is important to consider. The next is HIA. I'll write the full name here. And that would be a type of brain injury which causes lack of oxygen going to the brain. And the next to consider is metabolic disorders. So the last but not the least, again, we keep going back to it, which is poverty. So we talked about how that can cause both stress on the mother and it can lead to lack of nutrition. So again, if you have a support system, please don't be too shy or scared to ask for help. And if there are places where you can get help, please try and do. And the next is postnatal. So this postnatal period is from 1 month after the child is born and until the child grows up. So postnatally, what can cause developmental delay in the child is metabolic disorders or toxins. Again, we discussed the toxins, but now I have a very specific word of advice. Because now the child is not in the mother's womb, the child is exploring, the child is looking around, the child is picking up things and putting it in their mouth. We have many items, many household chemicals like bleach and cleaners and soaps and, for example, creams that could be toxic to the child. So we need to make sure that when a child is playing, these items are not near them and they are unable to reach them. The other thing is, as a community, we need to make sure that if someone is, a parent or mother is using skin lightening creams, for example, a lot of them contain a very harmful chemical called mercury. So it's important, especially with those, to make sure that they are nowhere near or in the reach of children, that they may either be able to ingest it or, apply it or play with it. Another would be trauma. So the child, for example, experiencing head trauma and hitting their head somewhere, or someone picking up the child and shaking them, which is shaken baby syndrome. So it's important at any of these events to make sure to seek very quickly medical help and advice, and also be aware that this could eventually cause your child to have developmental delay. The next is infections. Infections to the child, for example, meningitis, could affect their development and lead them to have a delay. The other is maternal stress. Again, when the mother is stressed, for example, this is one way. Maybe she's not producing enough milk for the child, which is crucial, especially in these initial stages of development and life in general. So that could affect the child's nutrition and then cause them to have a developmental delay. Now, this is important, and again, a child does sense when their mother is stressed. So try to use relaxation techniques. Take deep breaths in, for example, if you do feel like, of course, being a mother is a stressful job. It's not rainbows and sunshine all the time, but inshallah, it'll get better with time. And if it doesn't, please, again, there's a lot of resources. There's many people willing to help. If you have people that can support you, never be afraid to ask for help in these situations and explain your situation. The next is maltreatment or domestic violence. For example, if the child is in the midst of a parent or a spouse or other children that are very violent, it's important to protect that child from them however way possible. And to be honest, I cannot explain that. Is very contextual. It depends on the situation. But again, proximity. When you take the child away, it's better for the child. Or not have that person interact with the child in a certain place, or keep the child in a certain room alone, for example, until they need to be tended to, for example, or they need to play. And those are just a few ways, but that varies from situation to situation. Again, that's not something I can talk about right now. And the next is again poverty. If there are people you think are willing to help, please ask for help. The last would be again malnutrition. So there's certain vitamins, there's certain minerals that a person may be deficient in, whether it's the mother or the child. So if the mother is deficient, most of the time the child is also deficient, or sometimes the child even is able to get those nutrients from the mother, but at the expense of the mother. So it depends on the situation, and please seek medical advice if you think that's happening to you, or if you see certain drastic changes in your health, inshallah. So this is the end of this video for today, and see you next time when we'll look at the assessment for a child with developmental delay. Assalamu alaikum wa rahmatullahi wa barakatuh.